So now we are joined by Dr. Roderico Ofrin, WHO representative to India. Dr. Roderico, we're talking about self-care. Could you tell us the role of self-care in achieving the right to health?
Yes, thank you very much, Ambika. It's a big question, and it's something probably that was not answered before. WHO's definition of self-care is the ability of individuals, their families, communities to promote their own health, prevent disease, maintain health, maybe to access a health service, and cope with illnesses or disabilities with or without the support of a health worker. It is very much linked to the health literacy of people. Health literacy meaning how you understand health, how you understand symptoms, how willing are you to reach out for health services. It recognizes individuals as active agents in managing their own health care. And in that in itself is the right to health. Once a person embodies that health is their right, then self-care comes in, because that person will start looking for information, understanding what they are feeling, when will they actually access a service, but they will start with helping themselves first. It is really a self-motivated way for health promotion, disease prevention, rather than just disease curing. Sometimes self-medication when it is simple. Right. It does not replace the healthcare system. I think that's the caveat that I would like to put out there. It doesn't mean we're saying self-care is important, then everybody just goes and does this themselves. It is that engagement right at the outset, understanding your body, understanding the symptoms you have, understanding basic illnesses and symptoms, and doing something about it. It provides additional choices and options for healthcare and does not at all replace the healthcare system.
Roderico, you see, India is the pharmacy capital of the world. We export vaccines to the world, but the most important question is, are we using those vaccines effectively in India, especially because the government of India is also focusing on Mission Indradhanush?
Just to tell you very shortly the success. During COVID, we've had a dip in terms of coverage for children, around 15%. That's huge if you have a 26 million birth cohort every year. Now, there was a lot of catch-up being done, really a speed up to catch up where these children are. We have been privileged to be part operationally with that the ministry is in these efforts that the ministry is doing at central and state level. And just to let you know, the recent estimates of WHO and UNICEF this July has shown that India has gone back and even higher pre-pandemic levels of coverage. Are we using the vaccines? Yes, and more. There is also the new policy to introduce HPV vaccines. But more importantly is to leverage the current or just the recently concluded intensified Mission Indradhanush to move to measles elimination, but also to create a whole system that through routine immunization, that the routine services will be able to cover all children everywhere, anywhere, anytime, with the vaccines that are required. Because vaccines saves lives. Vaccines is the most economically beneficial public health intervention that we have as of the moment to prevent disease, disability, and deaths.